welcome to Big C Energy. I'm Alison Haislip, and every episode I will be joined by a guest, and we will bitch about cancer because cancer can be a real dick. I'm not just the host, I'm also a current cancer patient. At the time of this recording, I am about 6 months post my double mastectomy surgery for breast cancer, which I was diagnosed with in August of 2025. I am also about 6 weeks post my final chemo treatment. All the cheers and applause, please. Oh my God. I'm just barely a few days away from having a second reconstruction surgery. I also have to do immunotherapy till the end of the year, and I have about 5 years of hormone therapy ahead of me. So I am on the journey. And today I'm speaking with someone who has also been very much on the journey. And what's very cool is he was very public about his journey from the very beginning and helped a lot of people understand what he was going through, all while keeping on a very fun, brave face during all of it. He is one of the OG YouTubers in science. He's an incredible entertainer. He's a comedian. He's also a best-selling author. He's also my friend, and I am talking about Hank Green. Hi, my friend.
Hello. Hi. How are you?
You know, been going through it, but today is a good day. And I say, I'm sure we will get into the weeds of this, but I know you are someone else who also had to go through chemo, and chemo is something that very much teaches you when you're having a good day, you appreciate it.
Yeah. Yeah. I mean, the amazing thing that I didn't realize about it is how variable the whole process was.
Yeah.
Yeah. There was a whole roller coaster to go through after every infusion where you're just like, okay, well, I feel okay today. And I feel worse for the next 3 days in a row. And then after that, I'm going to feel slowly better until I feel just good enough that they can try and do it to me again.
Tear you all down again. I know. Well, let's start at the beginning with you. You were diagnosed with Hodgkin's lymphoma, correct?
Yes.
Okay. And when did this happen, and how did the diagnosis come about?
So it's my we're recording this the day after my birthday.
Happy belated.
And so this is like also a cancer milestone for me because on 3 years ago on my birthday, I had just found out the day before that I had lymphoma. And
happy birthday.
Yeah. I mean, honestly, I was like, what a cosmic screw you. But at the same time, I was like, actually, I'm not thinking about that at all. Like, it's not like,
right.
No part of me is like, oh, I'm missing my birthday. It's like not on the list of concerns at the time.
Right. Bigger things.
Yeah. Yeah. So I had shingles like 3 times in a row, which is weird. And they were all mild cases. But it was weird enough that I was like, this is strange. Everybody thought it was strange. But that's a very unusual sign that there might be something wrong with you.
In case anyone is wondering.
Yes, it is when the chickenpox virus that you got when you were a kid because you were a kid before the vaccine reemerges in your nervous system instead of in your skin, which is where the chickenpox virus gets you. So it's like a painful rash. And it's caused by a virus. And it tends to reemerge when your immune system's a little messed up. Maybe you didn't sleep enough. Maybe you're stressed. Pregnancy, a big trigger for shingles.
So there's very common reasons it could pop up.
Yeah.
But 3 times in a row
3 times is weird.
Significant, yeah.
And I remember thinking that was weird. And then I had this lymph node in my armpit that was just like there.
Yeah.
And my doctor was like, well, you just had shingles on that side, so it's probably just your immune system fighting it off. But come back if if it doesn't go away, if it gets bigger. And so I just like kept an eye on it, and I like really was not concerned. Like I was like, well, you know. And so I went back in, and she was like, well, that's substantially bigger, and it feels weird. We'll send you for an ultrasound. Got the ultrasound. Almost immediately, it was like I was in the system. Oh. Yeah.
Yeah.
So you know, they said there's totally a chance that this isn't cancer, but I had gone from this is nothing to this is probably nothing to there's totally a chance that this isn't cancer. Like, you know, that transition where they're like, what you're saying is it probably is.
Yeah.
Yeah.
And there was something that you talked about at the beginning when you first became public with this, that like, it feels like the medical system is so slow rolling, but the moment it becomes quick.
It isn't. Yeah.
Yes.
Yeah. The ultrasound tech was like, I'm going to go see if I can go find a doctor.
Wow.
Because she couldn't say what she knew she was looking at. Yeah.
So then, did you get the diagnosis there in the room?
No, but he offered to do a biopsy in the room because he was like, we could do a needle biopsy and I could do it today. Or you could come in 2 days from now and do a full lymph node biopsy. And I would really suggest a second, because with lymphoma, the cancer tends to be the vast minority of the tumor. So it's just your lymph node. And the lymphoma cells, specifically in Hodgkin's, but also other lymphomas are like this. The cancer cells hang out in the lymph node and they recruit a bunch of other cells to like crowd around them and feed them and be nice to them. And so you pull cells out with a needle biopsy and you tend to just get healthy cells. And so they like to get the whole lymph node so they can do a bunch of slices and
yeah. So I learned with my biopsy, they biopsied my tumor in 3 different places. And I was told at the time of my biopsy that I had this very specific form of breast cancer. It was estrogen, progesterone positive, HER2 negative, which is the most common type of breast cancer. But I bring this up because then you have the surgery and they remove the whole tumor, and then they can do pathology on the whole tumor. And it turns out, psych, I was actually something called triple positive, which is progesterone, estrogen positive, and HER2 positive. And I was like, how does the biopsy get it wrong?
Yeah.
And it was explained to me that it's because tumors, like we all, tell me if you thought this, but like prior to any kind of cancer diagnosis, you sort of think a tumor is like a ball of all the same stuff.
Yeah.
And in reality, it can be like any kind of odd, weird shape, and different parts of the tumor can be different things. So it just so happened that the places they biopsied on my tumor said one thing, and then when they saw the whole thing, it was actually a different type of cancer. So it makes sense to me that your doctor was like, hey, come in 2 days so we can look at the whole thing instead of this little biopsy.
And interestingly, Hodgkin's is actually, different cancers are so different from each other. This is like the main lesson that everybody should know. Is like it's
wild. It's the Wild West.
It's a kind of disease. It is not a disease. It's like an infection or a virus or something. It's just like a billion different ways they can happen. And Hodgkin's actually is it tends to be very homogenous in both ways. One, across individuals. So people who get Hodgkin's, they tend to have very similar cancers, which is great for treatment because you could treat them all roughly the same way, unless something, goes wrong down the line. And also they tend to be very homogenous inside of a person's body. So Hodgkin's is one of the rare tumors where at stage 4, it still tends to be, it can still be curable. And
that's wonderful.
Yeah. And because it's like, with blood cancers, staging is different.
Right.
They don't really metastasize in the same way because they're already kind of everywhere. It's like they're everywhere. The
lymph system is.
As I started to say it, in the wet parts. You can't cut it
Somehow
out.
You made it worse. Can you actually real quick explain the difference? Because I feel like this is something people hear, but there's Hodgkin's lymphoma and there's non-Hodgkin's lymphoma. Like, what is the difference?
Sure. Basically, the difference is that there's lots of kinds of lymphoma, and Hodgkin's is the biggest category. Okay. And the non-Hodgkin's splits out into depending on how you filter. So, for example, with breast cancer, how you can have, there's the different hormone receptors that it can have or not have. And so that's part of staging. With lymphoma, with non-Hodgkin lymphoma, there's like 20 different kinds that it could be. Wow. It's just that Hodgkin lymphoma is like, I don't know, it's like 30% of lymphoma cases. So that's like the biggest pie piece, but not the majority. And also it sort of stands out because, and was named early because it tends to happen in younger people. And so it was seen as a disease. It was originally called Hodgkin's disease. It was seen as a disease. They didn't understand that it was cancer for a long time. And because it happened to young people, it was sort of like separated out. And it was like, this is like something that we need to pay attention to. Back like 200 years ago or 150 years ago, back when it was like, oh, old people die. They die of cancer. They die of they just die, like it's not like not as big of a deal. It is now.
Which is ridiculous, but yes.
It was, we've come a long way.
Okay. So what is going through your head when the doctors like come back in 2 days? So is this like your birthday's the day in between these 2 days, or when?
No, this was
the birthday's still coming up. Okay.
Yeah,
Got it.
Yeah. So I'm when I was pretty nervous, even looking at the ultrasound, because I could see the screen, and I was like, "Oh, that's not just one lymph node. There's like a bunch of stuff."
You had an idea. I don't think I would have known. Like I look at an ultrasound, I'm like, "What's going on in there?" I have no idea.
I'm what the doctors call an informed patient, which has its advantages and disadvantages.
Yes.
And so they were like. They were like, there's a really good chance that this isn't anything, but like we need to cut it out. And I didn't really. This is wild, but like I remember this so clearly because I journaled about it and then I wrote it into a comedy special. But the moment I realized that it was a big deal was when I went down to the day surgery check-in place to like say like, hey, I'm gonna get surgery in 2 days, and the woman at the desk was like, you could just like mail this paperwork in. And I was like, oh, but it's in 2 days. And she was like, well, you procrastinator. And I was like, oh no, it got scheduled just now. And she was like, oh. And I was like
her response.
So this is weird. This isn't how things go.
Right.
Like I'm in a different part of them. And that's when I like, it like landed that it was weird that what was going on. Whereas, the ultrasound tech was like, I'm going to go see if I can find a doctor. And I was like, it sounded like that was normal. And then the doctor was like, I think that we need to biopsy this. And that sounded like it was normal. But then the lady at the day surgery center was like, oh, I looked at you and I just immediately assumed that you were healthy. And now I don't anymore think that.
Yeah, I had a not dissimilar situation where like I felt a lump in my breast, and I called my gynecologist's office and I was like, hey, I felt this thing. Should I come in and get checked out? In the office, they were like, just come by. He'll fit you in today. And I was like, great. So drove in, he checks me out and he was like, hey, I feel what you feel, but it doesn't concern me. And he goes, but since this is something that runs in your family, let's just make sure. I'm like, okay, great. So like he prescribes me a mammogram. I go in a couple weeks later, I got a mammogram and an ultrasound, and the radiologist comes in and she goes, yeah, there's something there. It's what we call level 4 suspicious. So you're gonna have to come in again for a biopsy. And I'm like, oh man, all right. Like I'm still in like this. Like
I like level 4 suspicious.
Level 4 suspicious.
That sounds like like a high school student.
Right, but she handed me like a little chart, and the levels went up to level 7. So to me, level 4 was still something's happening, but it's still not super serious. And I go in for the biopsy a couple weeks later, and that's the first time, like, they're numbing me up and they're actually like putting this giant needle in me. And I remember laying there being like, guys, this feels excessive. Like, what are we doing? Why are we going through all this work? And I'm just like chatting with her while we're going through it. And I was like, both my mother and my aunt have had DCIS, which is stage 0. So like I've been very proactive about it. I started getting mammograms in my 30s. And she's like, okay. Anyway, finished the biopsy. And I'm like, all right, glad that's over with. And a few days later, I get this phone call and it's from the radiologist. And she literally goes, okay, so I guess you're not terribly surprised since it runs in your family, but it is cancer. And in my head, I'm like, wait, what? No. I was like, I thought we were just going through the motions here. It wasn't supposed to actually be that.
But isn't it? It's so great, though, that despite the fact that you just felt that you were going through the motions, that you went through the motions.
Yes.
And like a lot of people wouldn't. And like it's the hardest thing is to know when to take it seriously, because it's like, am I making nothing out of something here?
Right.
Yeah.
Yes. I mean, I actually thought that. I did have a moment before I went into my gyno at the beginning. I was like, you don't have to get you don't have to do this. You're fine. Yeah. You're fine.
Yeah.
You're fine.
Yeah.
And like, so I'm on the phone with the radiologist and I just get diagnosed, and I was getting ready to go out the door for a facial. And so I'm like still like collecting my bag and like getting ready and chatting with her and asking all these questions. And she's telling me the next steps. And I like get in my car and I drive off, and I got off the phone with her and I was like, I guess I call my mom. So I called my mom and I was like, hey mom, this just happened. And my mom's like, well, what do you do now? And I was like, oh, I have to call my GP because I'm supposed to get referrals to breast surgeons from her. So I call my GP and like leave a voicemail. And then at this point I'm parking for my facial. And in my brain, I go, wait, am I still going to a facial?
Yeah.
like I was just on autopilot to get, and I step out of my car and I look down and I was wearing disposable flip-flops. They're the flip-flops I keep by my door to just walk outside to go get my mail.
Yeah.
And I guess in my, cluster of getting ready and having this phone call, I didn't even have the wherewithal to go put on like real shoes.
Yeah.
I'd driven in these shoes I would have never driven. And I was like, oh my God. And I walk in, and thank God my facialist is someone who I've seen for 20 years. Because I walk in the door and she looks at me and she goes, what's going on? And I burst into tears. And but like that was the first, 20 minutes of me finding out my diagnosis. And it was just like, what is happening right now? Like your brain just sort of it shuts off.
Yeah. Like to a doctor, the news is like bad, but not like you have 6 months bad.
Right. Not
also,
dire.
This was a wild experience. So after I got the biopsy, I went into my GP to get like anxiety meds and like to talk through some stuff.
Yes.
And I was like, so also you're a doctor. Can you just tell me that I'm going to be here in like 3 months? Just because otherwise I have to like do some stuff. And she's like, look, you're probably going to be here in 3 months. And I was like, what?
Probably? Oh gosh.
I really shouldn't have asked.
Oh man. Yeah. I was very much given the privilege when I got the call. The first thing she said was, you're going to be just fine.
Yeah. So
she literally said, you're going to be just fine. It's just going to be annoying how many doctor's appointments you have to go to over the next few months.
Yeah. So a weird thing about where I was at that particular moment is that they knew I had a bunch of weird, messed up lymph nodes. And that's either lymphoma or it's metastatic disease from another cancer, which could be pancreatic cancer. It could be liver cancer. It could be lung cancer. It could be a bunch of stuff. And so like it really... It could have been melanoma. Like
they had to go down the tests first to figure out exactly where you were.
This is a scary thing about having like weird lymph nodes is that the good news is that it's lymphoma,
You're right.
And so and that's also a thing that happened in the room. Like so I had these weird lymph nodes, and the ultrasound tech called a doctor, and the first thing the doctor was like, take your shirt off, and he checked me for melanoma.
Oh.
And I which I didn't actually know at the time. He was like, I just want to check and see if how your skin's looking. And but that's what he was doing. Right. And I don't know if he should have told me that, but he didn't. Probably not. Probably like just like not freak this guy out too much right now because it could be nothing. And then and so like in the space the space between the biopsy and finding out was pretty long. And then I found out from my surgeon, who I was just like, can you call the lab and be like, what's up? And she was like, sure. And I went in to get my incision like inspected. And she was like, your incision looks great. They say that you have lymphoma, but they don't know what kind.
Ugh, gosh. And so like, how much longer do you have to wait?
It's complicated, it turns out.
Yeah.
Like to figure out all of the different ways, like there's all these different ways with lymphoma, especially there's so many different ways that it can happen. And so it's really like a manual process in a lot of ways still. This isn't the same thing for every cancer, but for lymphoma, they really have to like they have to stain the slides with different stains to see what surface proteins the cells have. And then they look at them with their eyes under a microscope. And then they have also like a machine that tells them how strongly the stains have been taken up. And it just takes time. And also, this is a thing that I was also told. They were like, when I talk to people in pathology, they're like, oh, you were a low priority case.
What? That's not something you want to...
Yeah, like Hodgkin's is like, a week doesn't matter, like,
right.
Yeah.
But you're like, this is the highest priority for me right now.
Yeah. But there's other people who are sicker than you, there's always somebody who's sicker than you. And
so how long, so when did you get like an actual prognosis? Like when did you say, was there a point where they were like, you are going to be okay?
Yeah, it kind of came in waves. Like first when I got the call, it was like a day later. So I shouldn't have made my surgeon tell me that I had lymphoma, but they didn't know what kind yet. She called and she was like, it's Hodgkin's, which is the best news.
Right.
Because it's so well understood. And it isn't just that it's like very treatable. It's that they understand the treatments really well because they've been doing it for so long, and they understand how much they need to give you without hurting you too bad. And like, so like not just this is a thing that I also didn't understand. Like part of cancer is not having cancer anymore. Is like, that's the ideal situation. And part of that is like not having lifelong side effects from your treatment, which can absolutely happen. And you could be cured of your cancer, but have terrible neuropathy in your feet that makes it so that it's difficult to walk for the rest of your life.
Right.
And so like finding that balance is like, that's the oncologist's constant, and the cancer researchers, that's what they're constantly working for, is to try and find the treatments that give you the best chance of good outcomes with the lowest chance of bad these long-term side effects. And so Hodgkin's if I had gotten diagnosed even 10 years earlier, I would have gotten so much more treatment unnecessarily, because it's really, really hard to do research on giving people less chemo.
Good point. Very good point. Yeah, that was something that was that the radiologist also said to me at the very beginning, because I did not know. We did not know if radiation was going to be involved. We did not know if chemo was going to be involved. We didn't know what my treatment plan was going to be yet. Yeah. But she did say, I'm thankful she said this. She was like, if you need chemo, she goes, it's not your grandma's chemo anymore. Yeah. She's like, it's much more manageable. Manageable seems to be the word that people, the medical industry is using. Is like a lot of chemo treatments are now manageable, which is exactly what I would say I went through. Manageable, yet very unpleasant is what it was.
I would call it the same. I mean, I remember going in for my last infusion and being like, boy, I would not want to have 8 of these left.
Oh, so let's get into the nitty gritty about that. Yeah. What was your chemo? Was that your first part of treatment? Like, or no, you had the surgery.
The surgery to remove the lymph nodes was just biopsy. No, they don't. With lymphoma, they can't. Like the surgery, like taking out the lymph nodes doesn't do you any good. Right. Because again, the cancer's in the wet parts. So, they just leave the lymph nodes in, and I amazingly, somewhat luckily, had a palpable lymph node that I could feel with my fingers. And so throughout treatment, I could actually feel it getting softer and smaller, which was really
that's
cool.
Great.
Yeah.
Okay. So what was your chemo treatment plan?
Yeah. So I had, I can't remember exactly what it's called, but it's like PET-mediated ABVD or something. Oh, wow. So the first piece of treatment is you get your scans and figure out where it is. So like the Hodgkin's was good news. And then later and then also I didn't have what's called B symptoms. So that's good news. I wasn't getting night sweats or losing a bunch of weight. And then I got my PET scan and found that it was indeed only in the places where the ultrasound had seen it. So I didn't have something on my spleen or something weird. Right. And so that was like, okay, now I was barely stage 2. Because it had like just showed up. Yeah.
I too am 2A. Yeah. Barely stage 2.
Yes. Stage 2A. That's I mean, it means totally different things in your cancer and my cancer, but we're buddies anyway. And so it had jumped to like one new lymph node cluster, and there was like one tiny little guy that was doing a little bit of excess glucose uptake. And so I did went from that, so they knew exactly what treatment I should do, which was either 4 rounds of chemo or 2 rounds of chemo and then radiation. Okay. And I got to choose that on my own, and I didn't have to choose it immediately. So I could see what chemo was like and make the call based on that. Oh,
you mean you could do the 2 and then decide to do 2 more, or do the 2 and then do radiation? Yeah. Oh, wow. That's nice. Yeah. That's a weird privilege to have for cancer treatment.
It's absolutely also like a privilege, because if I had breast tissue, I wouldn't have had that choice. Right. So only men are offered this. Oh. Well, I mean, it depends on where your cancer is, but like where my cancer was, they wouldn't want to do it to a person with a lot of breast tissue, because it would increase the risk of breast cancer. Wow. Really significantly. And
so what did you opt for?
I went through the chemo and I was like, I think I want to do radiation.
You're like, so you only did 2 rounds of chemo?
I did 4, like technically 4 infusions, but it's like the I don't know why they call each one of those, they call one round 2 infusions.
Oh, I see. Got it. Gosh.
And then there was a PET scan somewhere in the middle there where they were making sure that it was responding.
That it was working. Yeah.
And because they just, if there's no response, they stop you.
Oh yeah, God, you would never want to go through it unnecessarily.
To do other stuff, yeah.
There's a world in which I went through it unnecessarily because I had my surgery first, and then we found out I had this specific kind of cancer, and I would have had chemo first, so they could watch it respond.
Yeah.
So they were like, listen, we're going to put you through this round of chemo because we know it works, but there were no extra scans for me because there was nothing left to scan. So it's like, there is a world where I didn't have to go through those 4.5 months of my life, but for the insurance policy, I did it.
That's the thing. I mean, this is what at that point, it's what's called adjuvant, I guess. It probably isn't thought of it that way in the situation you were in. But a lot of people get chemo when they don't have any visible cancer in their body.
Right.
Because the chances of there being microscopic disease are high enough.
Exactly.
Yeah.
Exactly. Which is why I did it. And, so let's get into the chemo. What were your side effects? Because this is a thing that I've learned too, is
so many.
I mean, one, there's so many different types of chemo medications that can cause all sorts of different side effects. And it's like no one person is going to have the same combo of side effects. So what did you have to do?
Do you know what your chemo drugs were? I can tell you if we have overlap.
I can tell you it's called TCHP. Okay. T and C were the chemo drugs, which T is. Oh gosh, it doesn't begin with a T. The T's in the word. It's like doxycytrin or something like that.
Yeah. It used to be called Taxotere.
Yes, exactly. That's why they call it T. And then the C is the one that lowers your white blood cell count.
Carboplatin.
Yep, that's it.
Yep.
Thank you. I'm glad I'm talking to the science guy about this because I'm like the T.
So I didn't get any of the same drugs as you. I had adriamycin, which also had another name.
Is that the one that's referred to as the Red Devil?
That's bleomycin, which I also took.
Okay. Because I keep hearing people in the chemo world talking about the Red Devil, which is like the one just like it puts people on their asses apparently.
Yeah. When I got that one, they said.
Oh, you did get that one?
Yeah, I got that one. And when they give it to you, they're like, okay, drink some water now. They like you to pee as soon as possible because they don't like this one hanging around inside of your body.
Oh, wow.
And I'm like, well, why are you putting it in me if you don't want it in me?
I know.
But the idea is if it's been through your kidneys, get it out. It's done all its work. And and then vinblastine and doxorubicin. And they all have like multiple names, so it's very confusing. But this is like stuff that people have been getting since the 70s.
Yes.
So my chemo was like $15. It was wild.
Wow. Dude, when I saw my first bill to my insurance for my very first chemo treatment, it was about $115,000.
Wow.
For my first treatment. I was like, oh my God. Now listen, my insurance covered every penny of it. And so I was like, okay, but like seeing that number, I was like, it's crazy.
Yeah, and the crazy thing is, like, I think it was literally less than $100 per infusion.
Wow.
The medicines they gave me
are so old school. They're
like they've been in the public domain forever. And but if I had kept doing chemo, they switched the bleomycin for a different drug because bleo will eventually mess up your lungs too much.
Oh, wow.
And that switch would have made it into $30,000 per infusion.
Yeah.
Because the one that they switch it out with is a new drug.
Yeah. One of the immunotherapy drugs I am on can also cause heart issues. So I have to get an echocardiogram every 3 months, to make sure the drug that's saving my life doesn't also kill me.
Yeah. And that was a really interesting piece of chemo is that the first thing I did was a bunch of baseline tests. So I went in and I went into a chamber and I blew into a tube. I got an echocardiogram and just to we'd have baselines for my lungs and heart, just in case I had to do a lot of chemo and get those things checked out. So that's fun.
Yeah.
And they also gave me, there's some did you get pre-treatment drugs along with your drugs?
Like the day of?
Yeah.
Yeah, I had steroids and Benadryl, which made me so wackadoo.
Wackadoo.
Oh my God. I knew the moment the Benadryl like hit me. I was like, goodbye.
Yeah.
Also, like an anti-heartburn medication.
Yep.
And there was one other, an anti-nausea medication, which I was very lucky.
Yeah.
I never dealt with nausea in chemo. And I don't know if it's that anti-nausea thing that they gave me lasted long enough.
Really help.
But I also did acupuncture during it all, which one of the chemo nurses said that might be the reason I didn't deal with any nausea. But like, that was not, I had days of feeling queasy and feeling off, but like, I never was concerned that I might be throwing up at any point.
Oh, wow.
Yeah, I take it you had the opposite.
No. I actually never puked, but I was nauseous a lot.
Yeah.
And I have a friend who had the exact same chemo as me, same cancer, he had to take medicine for longer than me because he was higher stage. And he was puking the whole time. And it's just bad luck, man.
Yeah.
It's just luck.
I too have a friend who got diagnosed with the same exact type of cancer and started her same chemo treatment as me, started 4 days after me. So we were like literally 4 days apart on our cycle and we're texting each other constantly.
Yeah.
And like she was dealing with like rashes and nosebleeds. And I was and I got hit by fatigue way harder than she did. So it's just crazy.
Yeah. Yeah, the fatigue was intense for me. That was my biggest, like if you were going to call one symptom, the big symptom, it was fatigue.
Yeah.
It was. I tried to go for a walk every day, and like the walks just kept getting shorter.
Yep.
It was like if I can get up and down stairs, then that counts.
Yeah. I'm still in the period of time because you and I talked about this offline a little bit, but like I'm still in the period of time where my muscles hurt constantly. Like it feels like I did a really hard workout yesterday and like didn't stretch, but it's so I'm fine sitting here, but this moment you see me walking up and down steps, it's like I'm 80 years old. I'm like,
that's wild.
Yeah.
No idea.
I know.
No idea. Like, and also like no one ever has any idea what's going on. But I was very like active with my nausea meds. So I got a pre-treatment nausea med and the dexamethasone also helps with that, the steroid.
Yeah.
And I remember after my first chemo treatment being like, I feel great. And they're like, we did just give you your first high dose of steroids of your life.
That's what you don't realize. It's like the day after your treatment, you're still on so many steroids that like I went and ran errands. I got all my stuff done. I was like, I'm hungry. I'm fine. Yeah, exactly. And then it would be like halfway through the next day that I'm like, the steroids are gone. And like the crash would come, I'd call it. And I'd have the crash for like 5 days.
Yeah. By the end of it, I did not feel good. In the chair, I was feeling bad pretty immediately. But at first I was like, I think if the chemo days feel like this, I won't hate coming in here. But by the end of it, I did hate coming in there. And
I said to one of our chemo nurses, it was like, I did 6 cycles. And when I walked in for my 6th cycle, this guy, Mac, he's great. He was like, how are we doing today, Allison? I was like, I'm over it. Yeah. I'm over it, Mac. And he's like, okay, we'll get you through the last one. I'm like, thank you.
Radiation is weird because you go in every day.
Yeah.
And so you just like see the same people every day for weeks. And you're like, hello, I'm back. Hello.
So how long was your radiation treatment?
I think it was 2 weeks. I think it may have been more of that. But it's a totally different experience from, like at first I didn't have to get very much, but it's a totally different experience from chemo. In that, like, your first day, you have no symptoms.
Right.
And then, like, you continue to have no symptoms, but then, like, every day is a little worse.
Yeah.
And then, the last day of radiation is going to be the worst day of radiation, no matter how long you're doing it.
Right.
And it's just, like, compounds. And what it added up to was fatigue. And I felt better really fast after stopping chemo. Good. I mean, better.
Right.
In comparison.
I know. That's what I'm saying. When you have a good day, you're like, it's a really good day.
And especially cognitively, which was a big worry for me. And like, because like all of chemo was brain fog.
Yes.
And then, but I should keep going with chemo symptoms. They're so weird. Like I got really bad constipation, which I'd never had in my life. And that was very troubling to deal with.
Well, that's what anti-nausea meds do to you.
Yep. And it just messes with everything. And then I would go down every night before bed, and I would mix Miralax and Gatorade and Metamucil, and I'd call up my powders. I'm going to go mix up my powders, and that really helped. And then I got the worst heartburn of my life, and it was so bad I had no idea what it was.
Oh,
because it didn't feel like I had like the heartburn I had experienced previously. It felt like burning in my heart area, which was worrying.
Yeah.
And so I was at the infusion center, and I was like, this has been happening to me. It's probably heartburn, but I don't know. It's, I'm worried. I was worried all the time.
Of course.
And they were like, oh, we got it. We got you. And so what they do is they mix like an antacid, like a liquid antacid with lidocaine. And they just have you drink it. And if the pain goes away, it's heartburn. And that's the test.
But wouldn't the lidocaine make any? Oh, because it's actually touching. And now I understand.
It numbs your esophagus.
It numbs your esophagus. That's so funny. Oh my gosh. So during all this, how's your family doing during all this?
Pretty good. Oren was 6. And so he was, like if I relapsed now, he would have a lot of awareness of what's going on. In a way that he did not then.
Then, yeah.
So if I relapsed now, I think Oren would be like very worried. He knows that people die of cancer,
right? In
a way that he did not when he was 6. And we didn't have to have that conversation with him because it was such an unlikely thing to have happen.
Thank goodness.
I guess I should. Once I knew my stage, it was like you've got like a 90+% chance of dying of something else. And,
okay.
and like a 95% chance of being alive in 5 years. So Great. So that was good. It sounds weird to call that good because like at the time I was diagnosed, I felt like I had a much higher than 95%.
Yeah, you're like, I was looking for 100
years,
you guys. Yeah.
Yeah. But then once it started responding, then that takes the percentages down even further. And so so we knew we didn't have to have that conversation. But he was really good about like, cause I was the surgery and like, I'm pathetic. He was very like empathetic, weirdly, as a 6-year-old. He was very careful with me, which was great. Catherine, of course, also was fantastic. I mean, you just like, this is the thing about partnerships is like, sometimes you got to be the strong one. And she just did that and didn't complain. And, I will say the TV took over a lot of the childcare duties.
I think that's acceptable. I think if ever there's a time, if ever screen time was warranted.
Yeah. Now Oren has a very like a weirder relationship with it, where he really doesn't like to see pictures of me when I didn't have hair. He doesn't like to talk about it. And this all makes sense. He won't. I don't think he'll remember it. I don't think he'll remember what it was like being inside of it, but I think he'll remember his feelings that he's having now about it.
Sure.
He'll be carrying that. But luckily, I was really only out of commission for 3 or 4 months. The scariest part was over pretty quick. There were these weeks of uncertainty up at the front, and then we just got good news. And that's just luck,
Yeah.
We got good news, and then we kept getting good news. I didn't ever have to go off chemo. I was able to stay on my treatment plan. I didn't have to go off treatment at all. I didn't have any serious complications. And the cancer responded, and, I got news even before I was done with radiation that I was in remission.
Great.
They actually didn't let me. They were like, you will be in remission the day that you finish radiation. And I was like, well, that doesn't actually make sense physiologically. And they're like, no, but we don't want you to stop doing radiation. Like it's not a physiological distinction for them. It's like a treatment distinction. It's like you are not in remission if you're still in if you're still in this kind of treatment.
Yeah. Yeah, right after I finished chemo, so I got my oncology done at UCLA here, and UCLA offers cancer therapy, like a therapist who specifically talks with cancer patients. And I was chatting with her, and after our session, or during our session, that was after my last chemo treatment, and she's like, "Congratulations, you're officially in survivorship." And I'm like, Is that the distinction? Like, I just have to fit, because like I still have immunotherapy, I still have another surgery, I still have all this other stuff, but like I guess I fit because I don't need radiation, which is great. So chemo was the end of my active treatment, and I was like, okay, survivorship. But even that word, I've had a really hard time with during this journey because I understand that that's the word they use, but to me, again, like from day one, I've always been told I'll be fine. So I don't feel like I've necessarily like survived anything. Like I'm like, you survived a car accident. You know what I mean? I've gone through a really shitty time. I'm not going to deny that, but like, I've been saying I feel like I have imposter syndrome when people use that word with me.
Yeah, I think that this is fairly common. I feel the same way. You know, we use whatever word is comfortable, of course, but like, you know, if you're in a terrible plane accident and then like you're alive afterward, you know,
yes, I survived that. Yes.
Yeah, I mean, I guess the thing is that you don't really feel like you could have died.
Right.
I kind of do.
Yeah, I mean, no one ever told me 95%. I always got 100, so I get it.
And what I do think about is like, without treatment, you know.
Yes. Yeah.
And like weirdly, like some people don't get treatment. And
that was actually something we talked about in my cancer therapy as well, because I was like, you know, I'm doing the thing I have to do. Like I don't have another choice. And she goes, well, you could choose to not get treatment. And I was like, no, take that off the table right away. That was never going to be an option in my life, you know. You know, unlike you, when you say, what did you call yourself? A well-informed patient? What was it?
Yeah, I don't remember what I said.
But something along those lines, like, I've always considered myself like I'm a straight A student. So it was like the moment I did all my homework and there was no option for me not doing that. Yeah. My brain is not wired that way, you know?
Yeah. I also was like trying to get an A in cancer for sure.
Yeah, an A in cancer. Right. So I tied into that, what made you decide to go public with your diagnosis and as early on as you did? And I have to imagine you had some like strange sense of fascination with it all too, because of your career and what you've focused on.
Yeah. I mean, like I was already a little bit fascinated with cancer. And God was like, here.
Yeah. Congratulations. One of
my most viral tweets of all time was, they say that God gives his toughest battles to his toughest warriors.
Yes.
Which is why he gave me the most treatable, easiest to deal with kind of cancer.
Congrats.
Because he knew I was a wuss. I mean, I didn't ultimately have much choice. I make a YouTube video every week and have for like 15 years.
Right.
And so it would be weird if I just disappeared or like all my hair fell out.
And it wasn't acknowledged.
Yeah. And also like there's like a segment. The problem is like there's a segment of the world that's, you know, hundreds of thousands of people big, you know, my core audience.
Right.
That I really desperately wanted to tell. And then there's like the rest of the world that I like could kind of give or take.
Like the unsolicited medical advice people feel the need to give online.
I am blissfully immune to that, both because it does not affect me, but also because people just don't do it to me. They're like,
oh, great.
I'm not going to send unsolicited medical advice to Hank Green. That would be maybe he's going
to make water wet.
Put me on my place. Yeah. So I really didn't get very much of that, though I see it in every reply section to somebody who's talking about their cancer who's not me.
Yes.
You know, like I was worried that I was like going to become the cancer guy.
Yeah.
And all of the other things that I have been working my whole life to sort of build up as like my career would be sidelined by it. And certainly that was the case for a while. But people don't think about the fact that I had cancer 10 years later.
Oh, good.
You know, it's just like, you don't have to worry about that.
Honestly, I had a very similar feeling signing on to this podcast.
You're like,
I was like, I want to do this. It feels like the thing I should do, but I don't want to be defined as like the cancer girl because of the podcast.
What I did not anticipate, but luckily John, my brother, did, was that it would be press. Like there would be press. It'd be like articles about it, and people would want information. And so like we worked with John's publicist to manage my cancer, which is wild.
Oh my gosh.
Just for like a week. And then, very quickly, I realized that like a science story was happening to me. And that's what I do for a living. And it's just like fascinating. It's almost like, having an enemy who you're also like kind of fascinated by, which I do in the real world too. Oh,
there you go. It's like it's Killing Eve. That's like the entire plot of Killing Eve.
Exactly. That stuff. Yeah. So I felt that way. And, I was like, where did all these medicines come from? Like one of them, vincristine, comes from a little flower, and they have to grow giant greenhouses full of this little flower still.
Oh.
And then they like grind them up and extract this molecule from them.
What did you think was the most fascinating thing you saw on your whole journey?
In the large scale, this is kind of difficult to communicate, but in the large scale, it's like a different understanding of what my body is. Mm-hmm. I am 30 trillion-ish cells, and they're all working together to be Hank. And like they'll murder themselves at the merest whiff of a problem, They're like very good at that. Or they'll murder themselves for just to like, your hairs. I didn't realize this about hair until I got chemo, but your hairs are made of dead cells. They're just stacked up dead cells that have they get to the top of the follicle, and then they just like squeeze all the water out of themselves, and they're full of keratin. And then they stick to the other cells around them, and they turn into hair. And so they're just like killing themselves for me so that I can have hair, on my, on my nipple, like two of them. And it's like
nipple,
like nobody needs you to do that, but like, they're just dying for me constantly.
Well, and then, it was explained to me, like during chemo, is the reason people lose their hair and their taste buds is because chemo medications are trained to basically take out faster growing cells, because that's what a cancer cell is. And that's also your hair and your taste buds.
Yeah. And I heard this and I was like, why the heck is my hair cells growing so fast? But it's because they have to make a bunch of themselves so that because the hair is made out of the cells.
Yeah.
Yeah. And then all of the entire lining of the digestive system is fast growing. And so that's why there's gastro symptoms that go along with it. And the nervous system is like kind of different. It messes with the nervous system in other ways.
Right.
But
did you deal with any neuropathy or anything?
I did a little bit. Yeah. I had like, it was like a year before my pinky finger wasn't. I mean, it kind of feels a little bit like when I focus on it, I can.
Oh no! Did I make you think about it?
I could kind of feel.
You're like, I'd forgotten about that trauma.
Yeah, but it was just the tips of two of my fingers, and it went away.
What inspired you to turn all of this knowledge and experience that you had just gone through into a comedy special? Like, was that your outlet, or did that feel like something you had to do?
I think there's always this craving to have something good come out of the bad.
Yes. And hence the reason I'm doing this podcast.
Also, when I first made my video, I was like, send me suggestions for video games, for apps, for, word games, for TV shows that you think that I'll like, because I'm going to be bored, and I'm going to be in bed. And I tried out so many of these things, and I couldn't enjoy anything because my brain was so foggy and I was so tired. But I could watch comedy specials because you fall asleep for 15 minutes and maybe they're in the middle of a bit, but they're going to be done with it soon, and they'll start a new one. And like Seinfeld, like a Seinfeld-like sitcom was also kind of this way, where it's like, it doesn't matter what happens episode to episode. And so I could watch Seinfeld. I could watch especially stuff I'd seen before. But But comedy specials were like the only thing that was like new, or I felt like I was watching something new and, you know, maybe even fresh, like, or something that like I'd always wanted to watch and I never had. And so I watched so much comedy. I got deep. I was watching people who like comedy specials on YouTube that had like 30,000 views, you know? I was like, tracing relationships between comics, like, you know, this person opened for this person. Where are they from? Like, what's the thing there? And
oh my gosh, it became your own reality TV show.
Yeah. and I just got like deep, and I started like have comedy shaped thoughts. This happens to me.
Right.
And I started,
you're also naturally a funny person, so it seems like
I do a kind of comedy like thing. I used to be a comedy musician, and so like I have experience standing on stage and making people laugh.
Right.
And once I ended chemo, I was like, I got to do this, and I like hired the best comedian in Missoula to be my coach, and during radiation, I was up on the stage.
Really?
Yeah.
I didn't realize you were doing it during treatment. That's incredible.
Yeah.
Yeah.
Yeah, I did like 10 weeks in a row. And the first day I did 15 minutes. And I just like built up from there. And I tried it like 1,000 different ways. And like Sarah was amazing at like, you know, she was like ruthless too. She was like, she was like, you have so much going for you. You need to stand still sometimes. But it was like, you need, like, I want you to go do 10 minutes without your feet moving. Like just do it to your wall. Do 10 minutes without your feet. Like, and I don't want you to sway. I want you to have equal weight on each of your feet. And then when you move, which you're going to do because you're great at it. Like, it's great when you are moving, but like when it's intentional, it's going to feel like something. And so like understanding the physicality of stand up, and like what, like it's so beautiful. Like now that I understand it, and you can like watch a comedian like conduct the audience like they're his orchestra, you know. I love that.
Yes.
So I just got obsessed with it.
Yeah, I love that. Well, you need to know. I mean, I'm sure many people have thought this, but like when I got my diagnosis, you know, eventually the algorithm figures it out. You know, the Instagram has become very aware that I have cancer.
It's unacceptable.
I know. It's terrifying.
When I'm like having cancer anxiety, it'll figure it out.
Yeah. Yes.
It's like 30 seconds in. It's like, hey, I got you a cancer story.
Yeah. So it started showing me, I mean, I already follow you, but it clearly started showing me clips of your special.
Cool.
And you call it pissing out cancer, correct?
Yeah. Yes.
Yes.
That's what
and
it's
the very like clear clip of you finding out that your pee is cloudy because that's the dead cells. That's you peeing out the dead cells.
Yeah.
And that was fed to me while I was in the midst of cancer, or while I was in the midst of chemo.
Yeah.
And I just remember watching it being like, oh yeah, like there was something so empowering about it, and being like, oh, my body is doing this incredible work. And also, here's my buddy Hank, who like we hadn't talked in a few years, but I was like, I also know this person, and like, you know, there was just like a kinship there, and I was like, it was like in one of the ways, like thank God the algorithm was there. Because it made me reconnect. It made me think of you. It's obviously why I wanted to have you on this podcast as well. But like, you should know that what you are doing is getting out there and resonating with people, because it did just that with me.
Yeah, it was really scary too, because, you know, in the imposter syndrome way, where like, you know, I don't want people to think I'm making jokes about cancer as a guy who's going to be fine, and like your, you know, husband or child or father or self is not going to be fine, you know?
Right.
And I was a little freaked out by that. And I did it a lot. I showed it to people, and I've literally never gotten that feedback.
Right.
Like, and I think that like part of it is that everybody knows everybody's story is different. And part of it is like, this is like one of the big pieces of advice I give, because now I get people calling me.
I'm sure. Yes.
Is like, what you got to know is like, you're going to be alive this whole time, you know, all of the days, like being sick is not being dead. Being sick is not, it's being alive. And there's going to be good days and there's going to be bad days. You're going to have great days when you're on chemo. You're going to have like the fun things will happen to you and like, or like lovely little things, you know, just like you should continue to live because, you know, depression is not good for healing. And it's really easy to get depressed. It's so easy to get depressed because like, it can, especially with when you've got a diagnosis that's like much more confusing, maybe you don't know where you're headed, or you know that you are terminal, but like how long and et cetera. Like it's impossible to not be like, oh, like I was working towards something and now like I'm over in this direction. Like,
yeah,
can I ever trust this body again? And so the understanding that like, you know, we're all headed to the same place. But like, you know, being sick is like living, you know?
It's almost a privilege.
Yeah. I mean, compared.
Yeah. I'm really glad you said that because that has been a thought for me as well, specifically with this podcast. Like I wanted to create a space where, you know, two of us who have gone through this before can sit here and bitch about it because we have the privilege of bitching about it.
Yeah.
Like we are here, we went through it and we did it and we are alive and we get to do that. And I'm hoping what that will encourage people to do, what, you know, if they have their own diagnosis, at least it's giving them a community and a place to be like, oh, I can think that way. I can think these absurdist thoughts at these points, or at least encourage people to be more aware of their own health because early detection is the reason we are here.
You know, we're all crazy, you know, and so it can feel like you're making a thing up and like, what a ridiculous thing to have it turn out to be, you know, when you're like, I'm worried it's going to be cancer. And then you're right. It's ridiculous. That's not how that goes.
That doesn't happen to me. I mean, that's definitely what I thought. I was like, I'm not the person who gets cancer. Yeah. Apparently I am.
Yeah, I go in and the doctor kind of rolls their eyes and they're like, no, you're fine. That's how this goes.
Yes. And I go get my facial with my normal shoes on, you know? Yeah. Hank, have you had anything to say to someone who's listening to this who maybe just got a diagnosis or is at the beginning of their journey? Like what is the best piece of advice you think you can give someone?
Journal. This is like, and even if it's as simple as just a symptom journal, like it's just really good to know where you're at day to day. And you are not going to remember accurately if you don't write stuff down. Yeah. But also like, so there's like that element of it where you're just like, oh, what was day 3 like on the last infusion cycle? And like, maybe what the way I'm feeling is like, that's just how it feels. But more than that, if you can get some thoughts down, you know, we are impenetrable to ourselves. And so like anything you can do to sort of like get some roots in and try and figure out where you're at is really valuable. And then also I had a list of good newses that I had received, you know, so it was like, I knew that there was some bad news, but I didn't have a list of those because I thought about those all the time, whereas I didn't think about every day, like what, you know, it's really wonderful that this happened to me at a time in my life when I had a stable relationship and I and like somebody who could be a caregiver in the house. It's, you know, it's great that it's like the number one thing is like it's Hodgkin's, right? And you know, and we caught it early, like that kind of thing. There's always these little wins. I have a friend who had her baby came very early. It was very hard, and and like she's a developer and she coded an app. I think it's called Little Wins. Like she coded her own little app while she's like, you know, going through all of this. And like, she just like wrote down all the little wins. And it's like kind of the same thing where it's like, what are the little wins? So we can make sure that we aren't forgetting about that, you know? Yeah. Well, Hank, thank you so much. I'm so glad I got to reunite with you, even though this is the dumbest reason for us to reunite. I wish I could hug you at this moment, but you actually joined us from Montana. Thank you for taking the time to tune in with us. You definitely brought Big C energy.
And that's what we're hoping to get people to do. So thank you for joining us.
Yeah, absolutely.
Yeah. And for those of you who have tuned in today, if you're on your own cancer journey or if you're on the sidelines, please remember to trust your gut, advocate for your health, and bring your own Big C energy.